Let's think about anxiety from a trauma frame. So remember, when we talk about a disorder that we're talking about all of the letters have to be there. The numbers, we're looking at a certain proportion of them. So we know that there needs to be excessive anxiety and worry, or some apprehensive expectation occurring more days than not for at least 6 months about a number of events or activities. And that the person, finds it difficult to control the worry. In addition, numbers or letter C, we need at least 3 of the following symptoms, with those present more days than not for the past 6 months. So, those symptoms, we need 3 of restlessness or feeling keyed up, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, and sleep disturbance. In addition, there has to be clinically significant distress. This is D, or impairment. So maybe, it makes it difficult to study or go to school or go to work. Not due to the physiological effects of a substance or medical condition, such as hyperthyroidism, and not better explained by any other mental disorder. As we talked about in terms of separation anxiety, we're seeing a loss of safety, a lot of, difficulty with danger cues, loss of trust, problems with self-worth, sense of self, and connection to the body. You can see some of these things in this video, which I've posted on D2L. As, Bessel van der Kolk says, the core issue in trauma, is reality. So it's difficult, perhaps, for someone with anxiety to recognize whether or not they're feeling the way they are, and whether that makes sense or whether that is disproportional to the situation. They may respond with a lot of fear about situations that don't really cause problems. Now, one of the things that you're going to see is that there's this relationship between anxiety and depression, partly because of avoidance, that when we're anxious, we stay away from particular situations, which means that we don't get the fun in life that we otherwise would be getting. So there are a number of things we can do. We can challenge our irrational thinking. We can distinguish between safe and unsafe situations. We can build skills. We can help people develop active coping. And some of these are described in this video. So again, as you're thinking about anxiety and generalized anxiety disorder in particular, think about how this might be seen from a trauma lens. Again, not saying the trauma is the only cause of anxiety, just symptoms. There are some people who from birth are just more reactive. But how does that trauma shift your ability to recognize what is normal, what is safe, who is safe in the world? And with that, I'm going to say goodbye, and I'll see you in the next video.